Welcome to Startup Health Now, the podcast where we celebrate the most innovative entrepreneurs in health and the moonshots they're working to achieve. I'm Nicole Clark, Startup Health Senior Writer. Today, I'm pleased to introduce you to one of Startup Health's rising stars, Jakob Dahlberg, co-founder and CEO of the Swedish-based telemedicine company Joint Academy. At Joint Academy, Jakob's on a mission to prevent and reverse chronic joint pain worldwide. To give some context to their health moonshot, according to the Arthritis Foundation, 1 in 4 Americans will develop hip or knee osteoarthritis in their lifetime. And this 1 in 4 ratio is a conservative estimate. Experts suggest any maximum fixed lifespan has yet to be reached. In other words, human longevity is actually increasing. Some are calling it the silver tsunami. Now, as awesome as it is to know our chances of reaching the ripe age of 100 are increasing, our craning longevity has created a daunting demand for accessible treatment options that address issues with joint pain and immobility. That's why at Joint Academy, Jakob and his team have created an interactive digital treatment program for arthritis.
Yeah, so the simple explanation of what we are is that we're a digital clinic for chronic joint pain. So basically what that means is that instead of you jumping into your car and going to your traditional brick and mortar clinic and seeing your physical therapist, we deliver all care virtually instead. And then, as you mentioned, we're very focused on one chronic disease, which is called osteoarthritis, which is, chronic hip and knee pain in most cases.
Prior to Joint Academy's digital treatment program, treatment options for osteoarthritis patients were short-term, insufficient, and at worst, unvalidated.
In terms of how the landscape looked when we founded Joint Academy 5 years ago, there was way too many surgeries and too much medication being prescribed at that point of time. It is still, but it's getting much, much better in Sweden, for example. And what we can see is that the science tells you that you're supposed to do exercises, behavioral change, patient education, weight control, and things like that. But at a clinical level, still a lot of surgeries are going on. So that's basically, what we try to straighten out, so the patients actually get the right type of treatment versus getting the wrong ones. And in our moonshot and our vision is to become the global standard treatment for chronic joint pain. So as soon as you get the diagnosis, Joint Academy should always be the first line of defense. Like you should not, if you see it as a pyramid, and the fundamental part is exercise, behavioral change, education, weight control, etc. That's where Joint Academy is. That's where you should be referred. And then in the middle, you have pharmacological interventions, and at the end, you have surgery like total joint replacements, which is the last stop.
For the past 5 years, Joint Academy has documented the platform's impact on patient outcomes in peer-reviewed clinical studies. In one study, patients that used Joint Academy's online clinic for a 30-week period saw a 46% decrease in joint pain and an 88% average increase in physical function. This was all at 30% of the cost of traditional face-to-face treatment. When compared to surgical solutions, Joint Academy's interactive treatment program is 95% cheaper. It's also important to note that Jakob's startup has made inroads with populations in Sweden that prefer the traditional analog approach to treatment. People who aren't necessarily digital natives. In 2018, Joint Academy secured a partnership with Sweden's largest pharmacy to retail their platform as digital medicine. There, patients can receive a physical screening for chronic joint pain in the chain's brick-and-mortar stores, and pharmacists are trained to enroll patients onto the Joint Academy platform. So with solid groundwork laid in Sweden, Jakob has spent the better part of the last 2 years rolling out Joint Academy in the US.
So usually a patient finds us through an ad. It could be on Google by searching on joint pain, like a high intent search, or it could be a discovery where we just do a Facebook ad which says, are you experiencing symptoms and chronic pain in your hip and knee? Let's see if you have osteoarthritis and get connected with a licensed physical therapist online. So as soon as the patient downloads the app, either through App Store or Google Play, we have an intake questionnaire where we're basically asking these clinical and symptomatic questions. How much pain are you experiencing? What is your BMI? What is your gender? Trying to really assess, the current health and epidemiology, the disease state of the patient. Um, After that, they get connected to a vetted and licensed physical therapist, which we've subcontracted in our service. So there's like 1099 workers working extra time on the platform. And and then they have a kickoff call. It could be like a video call or a phone call where the physical therapist, does their own assessment to really, deem if this patient is eligible for this type of virtual treatment. And if so is the case, the treatment starts the day after. And, the patient starts receiving notifications. You're supposed to do these exercises. This is a lesson and an educational component you're supposed to complete. Maybe it's around, the disease, lifestyle changes and things like that. And then you have continuous tracking across the program in terms of, how much pain are you reducing, how are you improving quality of life, physical function, and things like that.
So, backing up a little bit, while Joint Academy launched in 2015, the startup's traction comes from a multi-generational effort to improve care. The company's chief medical officer and Dahlberg's father, Dr. Leif Dahlberg, is the brainchild behind Sweden's Better Care for People with Osteoarthritis initiative. It's locally referred to as BOA, B-O-A. Leif is an orthopedic professor, and 10 years ago, he developed the government-funded face-to-face intervention for those with chronic joint pain. Today, it's known as the gold standard for arthritis treatment, and it's included in Sweden's national health guidelines. So that means if you are a Swedish citizen with arthritis, you'll go through Leif's treatment plan.
So the easy analogy to really understand what the BOA program is, Better Management of Osteoarthritis, is to think about it as a DPP, which is quite prevalent in the US, a diabetes prevention program. So it's the same thing, but it happens to be for osteoarthritis and chronic joint pain instead. So he founded a face-to-face intervention. You came in and you saw your physical therapist for 3 months, and you got guided exercises, education, peer-to-peer support, data tracking, and all that stuff that we just mentioned Joint Academy entails as well. But you did it at a clinical level, so you did it in person. And this intervention was and became very, very successful. In Sweden, 200,000 patients completed the 3-month intervention. It basically became the standard practice here of how to treat osteoarthritis at the first instance. So that's, we took all that data, all that know-how, and that's basically what we digitized in Joint Academy.
In order to make inroads in the US, the Joint Academy team designed a roadmap to integrate their digital arthritis treatment from the health insurance side. Insurance companies in the US have a major incentive to partner with Joint Academy. It saves them money while improving patient lives. If patients can mitigate their arthritis symptoms through lifestyle changes like the ones supported on Joint Academy's platform, rather than leaning on insurance to pay for total joint replacement, injections, or medications, then that translates to dollars saved for everyone.
So we've had a lot of success already. We've been working intensively for 1 year, but on a broader period for almost 2 years now in the US market. And we've closed deals with some of the largest health plans, such as Blue Shield California and Humana, and a lot of other deals that will be disclosed soon as well. And we've recruited over 300 physical therapists in several different states across the US to be able to deliver our care. And we're right now in the hundreds of patients, which will soon also convert to the thousands as we're starting to roll out these very large contracts. So we're very, very optimistic that we could very much move the needle in the healthcare system in the US when it comes to chronic joint pain.
In recent months, as a result of the coronavirus pandemic, the demand for telemedicine options like Joint Academy has increased. And as the COVID-19 outbreak sparked a widespread shift from in-person medicine to telemedicine, the U.S. Department of Health and Human Services eased some HIPAA security rules to facilitate the transition to digital health.
And one of the common procedures for osteoarthritis is total joint replacements, which is basically what you call for elective surgeries. During the pandemic now, COVID-19, all elective surgeries has been canceled because they're high risk. They involve, of course, a lot of touching, but the risk group is also 65-year-olds, which we know is in the higher risk zone when it comes to the coronavirus. So, what the government needed to do was to find different solutions. So one of them is easing the telemedicine regulation. So we've seen that the current administration has waived a lot of telemedicine provisions which has been very favorable for us in terms of securing reimbursement with Center of Medicare and Medicaid, but also in general corporate practice medicine laws and things like that. So yes, there's been a lot of tailwind on a macro level when it comes to regulatory changes, but it's isolated from that. It's still fantastic for patients because now they could get access to proper care from their homes while all other typical care is getting canceled.
Joint Academy's success in scaling their digital platform during the pandemic builds a solid case for telehealth. It offers a bridge over current healthcare gaps, even in systems as big and complex as the U.S. healthcare system. And while the U.S. may not be able to import another country's entire healthcare infrastructure, thanks to health transformers like Jakob, they can adapt new approaches to address America's conditions. Startup Health is committed to keeping our finger on the pulse of health innovation. More than that, we invest in entrepreneurs who are committed to achieving health moonshots. Our growing army of health transformers is global, including more than 335 companies from 25 countries. To read more about the inspiring women and men in startup health, like Jakob Dahlberg, go to startuphealth.com and click on content. Thanks for joining me on Startup Health Now. Until next time.